us a second. Hi, this is Sally Flashberger with the Wisconsin Board for People with Developmental Disabilities, and it's Living Well Wednesday. We're here for another great presentation. We are have some of our experts here to talk about the COVID vaccine. So we know that the vaccine has just become available, and so we're going to get an update from two of our great experts who are sitting on some state committees. So we have Marcia Stickel, and she is a nurse who is participating on I'm going to look what it says, the State Disaster Medical Advisory Committee. And then also Mitch Hagopian, who is actually on the subcommittee of that advisory around the vaccines. Then we're going to give you a little introduction to our plain language document on the vaccine that we just created. Then we'll hear from our self-advocates, Ashley and Nathaniel, about the importance of getting the vaccine. So we're really excited. If you have any questions, please post them in the chat here on our Zoom, but also on our Facebook feed. And we'll be happy to answer whatever questions we can. So with that, I'm going to turn it over to Mitch. He's going to get us started talking about the work of the committee.
Well, hello, everybody. Nice to see, well, I don't see most of you, but nice to talk to all of you. Again, I've been on a couple of these. I'm Mitch Hagopian. I'm an attorney with Disability Rights Wisconsin. We're the protection and advocacy agency for people with disabilities in Wisconsin. And as Sally said, I'm the representative on behalf of people with disabilities on the State Disaster Medical Advisory Committee's subcommittee on vaccine allocation and implementation. So basically what we are is a group of probably about, I don't know, probably about 20 of us, whole range of different people. I'm the representative of the disability community. We have a representative from the elderly community. We have a whole bunch of doctors, a bunch of ethicists, and then people who represent various diversity interests. So it's a good group, very collegial and respectful of one another. And what we've been charged with by the state is to figure out, as this vaccine, which you just heard Sally say is now available in Wisconsin, who's going to get it? Because the problem is, even though the vaccine is available now and it's been approved by the FDA, which is the Food and Drug Administration, we're not going to get enough of it to give everybody who wants it as soon as they want it. So basically what's going on right now is this week Wisconsin received 49,000 doses of the vaccine from the Pfizer pharmaceutical company, Pfizer drug company. And so those doses, what we had to do as a committee is figure out who's going to get them, because there's a lot more than 49,000 people in Wisconsin who want to get the vaccine right now. So what we did, we spent a lot of time over the last couple of months trying to figure out what would be the fairest way to give out this vaccine as it becomes available, and who should get it, and you know, how it could do the most good by giving it to different people. So basically what we decided was that we need to give it to the frontline health workers first. We need to keep them healthy so that they can keep the rest of us healthy. So this first group of doses went pretty much to people who are in, working in emergency rooms and hospitals, caring for COVID patients and other people. And it got distributed pretty widely throughout the state. So that's where the first group of doses went. So even though it's available now, this vaccine is available, you can't just go out and pick it up from your local pharmacy. It's going to be distributed carefully and in accordance with a thoughtful plan that our committee has worked out. So as so the first 49,000 doses were distributed already, and I presume they're most have been taken already. We're about to get probably another group of doses. A different vaccine company makes this one. It's called Moderna. And we're not quite sure how many doses of this we're going to get. Originally, we were told on the committee that we'd get about 16,000 doses. But from what we kind of hear now, it might be a whole bunch more than that, more like 100,000 doses. So if that's the case, then that's great, because a lot more people will be able to get it sooner. Both, and Marcia's going to talk more about how this vaccine works, but both of them require you to get two shots, basically. So when we say we got 49,000 doses that we gave out this week, we actually means that we have about 98,000 doses laying around. We're just keeping the second one so that in a couple weeks, when it's time for the second dose to come, those same people will be able to get it. So, and then the same with the Moderna, when that comes and people get it, they will get a second dose as well. A couple things, you may have heard about these vaccines. The Pfizer vaccine requires super cold storage, like 80 degrees below zero or something like that. And there's not a lot of places that have, refrigerators that can do that. So that also limits a little bit as to, who we can give the vaccine to. And once you take it out of that super duper cold refrigerator, there's only a few days left before it becomes ineffective. So you have to give it to people pretty quickly after that. So what the state has done is take the vaccine from Pfizer and given it to, healthcare facilities, hospitals mostly, but not all hospitals, who have that refrigeration capacity. So they get it, and then they distribute it to the various people who are entitled to receive it. The Moderna vaccine, the next one that's coming, and that's the one we're going to probably get a whole bunch more of that, even if we don't get 100,000 right off the bat. Over the next couple of months, we're going to get a whole lot of the Moderna vaccine, because there's a lot more of it going to be available. And the good thing about that is that it doesn't have to be kept quite as cold as the Pfizer thing. So a lot more hospitals and healthcare facilities and public health departments will be able to keep it cold enough so that it stays, stays good and potent. And that makes it easier to distribute to a wider geographic area, because you can move it around further. You can keep it colder, easier for a longer period of time. So that's kind of what's going on in terms of the vaccine. Like I said, the first group of people who are getting it right now are healthcare workers. But starting with the next group of vaccines, which I believe will be the first group of Moderna ones, it's going to come out probably in a couple weeks, maybe next week. They're also going to start giving it out to people who are in skilled nursing facilities. So those are, people in nursing homes here in Wisconsin. They're the people who are most at risk from dying from this COVID thing. So it's important that they get vaccinated quickly. Older people who are in frail health and in, institutions are the most at risk, and they are the ones who are having the worst effects of it. Most of the deaths of people from COVID are happening to people who are in these facilities. So it's important that they, in addition to the healthcare workers, we get them vaccinated quickly so that we can put a stop to that as quickly as possible. Once those folks get vaccinated and all the healthcare workers get vaccinated, then we'll move on to the next group of people. And that's going to be, we're not sure yet. Our committee is going to start working on that tomorrow, actually, to figure it out. But it'll definitely be, other people who are at high risk of bad outcomes from COVID. So that will be people with intellectual disabilities. It'll be people maybe in family care and IRIS or in the children's long-term support programs. And it's going to also be what we call essential workers. So the people who make sure that, our economy keeps working right? So, and that we can keep access to the things that keep us alive. So grocery store workers, those people are essential. We need them to be able to stock the shelves so we can buy food and eat. People who, do utilities, the gas people and the electrical people. They need to get it too. And then other people, workers who are not in healthcare, but who provide services and supports, like educators. Teachers are going to be in that group too. So we're going to develop a plan for that group of people over the next couple of weeks. In the meantime, we got about 500,000 healthcare workers and people in nursing homes and other long-term care facilities who need to get vaccinated first. So that's going to take up the first, month or maybe more of vaccine that we get in Wisconsin. And only then will we move to that next group of people. But we're thinking about it, and our meetings are actually public if you ever want to watch them. We meet usually on Tuesday mornings at 7 in the morning, and then we meet usually on Fridays at 7 in the morning. And if you're interested in that, I'm sure Sally could provide you with the information to sit and watch us have our conversation, because we're a public entity and we have to meet in public. So with that, I'm just going to turn it over to Marcia, who's going to tell you more about the vaccine. I'll just finish with saying that this vaccine, and she's going to tell you this too, it's safe. And when you get a chance to get it, I strongly recommend that you get it. I'm not in one of those high risk groups, but boy, I wish I was, so that I don't wish I was, but but I sure wish I could get the vaccine. I'd be taking it. I'd be first in line, and I will be first in line as soon as it's fair to give it to someone who's like me, a healthy person who's not at risk of really bad outcome from it. So, Marcia, take it away.
I'm going to just wait before Marcia. I'm going to ask a question because I did have a question come in via email before our presentation. And so the person wanted to know, what about like people who are working in someone's home, or where do they kind of fit as a healthcare worker? And
Yep.
Was that determined?
Yeah,
I
sorry,
think that's probably an important question. And I think too, if you're maybe not, like, even if you're just a family member who supports a person with, significant medical needs.
Yeah, well, that's a group that is considered to be in the first group of people who will get it. Basically, it's all healthcare workers, and they define that pretty broadly, but it does include direct care workers. That's how they define them. So that doesn't, and it doesn't matter if they're paid or unpaid. So if you're a person who is supporting a person with a disability in their home, you will be in the first group of people who can get the vaccine. Now, for that workforce, especially like if you're an IRIS and you have participant hired workers, and you've hired your son or your daughter or your spouse or your sister to take care of you, it's going to be a little tricky to make sure you can get the vaccine. You're entitled to get it in that first group of people, but getting it to you is going to be a little bit trickier, and that's going to be an issue that you'll hear more about from people like BPDD and us, because you're probably going to have to get to a pharmacy to have it done, or maybe go to their local public health department. It's not quite as easy as if you work in a hospital, where they give shots all the time. They can just give it to their people, on their breaks and stuff like that. It's a little trickier for the direct care workforce, but they're definitely, they were considered, and they are considered to be people who definitely need to get vaccinated so they can stay safe and healthy and continue to provide care to people, who are vulnerable and in their homes. So good question. Thanks, Sally. I'm sorry I didn't address that directly.
That's okay. I see another question too, and I think this is what you're talking about. On Facebook, somebody's saying, how will her daughter has an intellectual disability, and how will she know when she's able to receive the vaccine? Which I think you just said you're starting to talk about that with the committee. And I will find the link for the public notices of the committee. We'll get that up. If not, we'll get it up in the chat and on Facebook too, so people can watch. Yeah. But I think that what you're saying is the committee keeps meeting. I think you told us before you're meeting twice a week, or you were. So it's pretty important work. And, we here too at Living Well, we plan to try to keep updating as we get new information so that people are aware. But I think that's one of the things that isn't quite finished being determined, right? Like how will the general public not involved with a health system or a nursing home get it?
Yeah, yeah. Well, you know, if you're in family care or you're an IRIS or you're on the CLTS waiver, I mean, you have an MCO and an interdisciplinary team, including a nurse who's keeping an eye on you. In family care or in IRIS, you have the IRIS consulting agency, and in CLTS, you have the county waiver agency. So those are all groups that the state, once they, you know, have enough vaccine to give it to people, they can contact those groups, and those people presumably, I mean, they will contact them and they'll tell them, hey, you know, this is available. And then those people hopefully will be telling you, you know, how you can actually get the vaccine into your arm. So,
Yeah, that's great. I think, people are anxious, right? They want to, for sure, know kind of their place in line. And I think the line is a little not formed quite yet.
it's not like a regular line. It's kind of like it's a line that's like about 50 people abreast. So
Correct.
yeah,
Right.
kind of funny.
Right.
But yeah, everyone will get it. And in the meantime, keep your mask on, wash your hands, and keep away from each other. Okay.
Yeah, there is someone commenting in the chat about their worker in their home not wearing a mask, and I think again we would tell anyone to go back to your care team or your IRIS consultant and really talk about what other supports and services you might be able to get if that person isn't keeping you safe in your home, because we know that is really, really important. And those care workers do work with other people usually. So hopefully they will be quickly getting the vaccine. So, all right, great. If we have any other questions come in for Mitch, we'll go back after Marcia, but Marcia's gonna can come in now and talk about the actual vaccine.
Okay. I really appreciate all that has been shared. I appreciate that people are eager to have the vaccine. I am delighted with that. The vaccine, the initial vaccine that's been approved, the Pfizer, and Moderna, which we hope will be approved by the end of this week. Tomorrow, there's going to be a group of professionals that kind of pick it apart to see if there's any reason not to initiate distribution. And it's expected that they will approve it because the FDA picked it apart already, looked at all the stats and said, this looks good. But it's wonderful that we have a group of professionals that none of them are affiliated with Moderna, the company, that are going to be looking at it tomorrow. And there is hope, definitely strong hope, that both Pfizer and Moderna are going to be available as of next week. They both are vaccines that use a code. It's called little m, big RNA. So it's the code from a tiny dead part or spike. You've probably seen pictures of the virus and it has spikes on it. So it's a code for that virus, that little part. And they put it in a solution with other things that help it work better as a vaccine. And then that solution is given in a shot. So you're not going to get a real virus. You're only getting a tiny little code of a dead part that then activates your immune system. When your body gets the shot, it goes, whoa, this is an enemy. And it gets your immune system activated so your soldier cells are then ready and prepared. And then if you're exposed to the virus, it can respond. It can respond so well. The data is, the information from the testing is that it's in the 90s, 90% effective, 94% effective, which is phenomenal for a vaccine. So these vaccines really work. They help your body be on the alert so it can fight if you get exposed to COVID-19. The other thing that you should know is it's it's been tested as rigorously, as carefully as any other vaccine. So it's something you can have faith and trust in. And I know we'll get to that in another question. Other vaccines are being developed, and they all work in a little bit different way in how they've developed them. But really, probably the most important thing for you to know is every one of the vaccines is using a different process, but not a live virus. So you absolutely can trust that if you get a shot, you are not getting the virus in the shot. You will not get the virus from any of the vaccines. And I think there's been some misconceptions about the vaccine. So I want to assure you, I like Mitch, I'd be right up there saying, shoot me, if I was first in line, and I'm not. The other thing to know, and I know that Mitch mentioned it, is for Pfizer, you will need to get another injection in 3 weeks. And Moderna, it's 4 weeks. And there's partial protection after the first injection, but not that much. So you really want to understand from the beginning that you will need 2 shots. Another concern or question is, well, who should get the vaccine? And I think we've already discussed that a bit. Everybody. Everyone should get the vaccine eventually, unless you have a condition in which your doctor tells you it wouldn't be safe. Also, if you're sick on the day that you're supposed to get the shot, you will probably need to wait, just like when you have a flu shot. They say don't get an immunization when you're sick with something else. The testing of the vaccine was not done on children under age 16, not done yet, I should say, or on people with immune systems that aren't working because they're having cancer treatment or because they've had a kidney transplant, something like that. People with autoimmune diseases like multiple sclerosis or Crohn's disease, pregnant women, or women who are breastfeeding. So those categories have not yet had clinical trials. That doesn't necessarily mean that if you fit in any of those categories, that you shouldn't get an immunization. What it does mean is you need to check with your doctor. I listened to some of the back and forth among the professionals last week when they were talking about Pfizer vaccine. And it was interesting to me because I had a number of doctors who said, well, I would want patients of mine who are pregnant to have the immunization. That vaccine is safer for them than getting COVID-19 disease. So I really would encourage, if in doubt, check with your doctor. But furthermore, they are already starting to do the clinical trials for people in those groups. So more information will be coming later. I've had some people say, well, should I wait? Should I wait to have the vaccine until more people have had it? And for most of us, unless you're a healthcare professional or in a nursing home, you're going to have to wait anyway. We see varying estimates of when all of the first people are going to be, the first groups, healthcare professionals and nursing home residents, are going to have their 2 doses. I've seen as early as the beginning of February. I've seen as end of February. So we don't know because we don't know yet how fast all of this is going to be administered and how many doses we're going to get. So the next question is the vaccine safe? And I think you've already heard a bit about that already. But I want to reassure you, there was a lot of political hoopla, or whatever you want to call it. A lot of push, I'll just say frankly, by our president, who will soon be out the door. Trump wanted a vaccine. He pushed hard to have a vaccine before the election. That didn't happen. And it didn't happen because rigorous testing takes time. There's clinical trials. There's 3 different types. I won't go into detail, but the last type is called a third trial or a phase 3 of testing. That went on and then was monitored for 2 months. And that's standard. So when you have a vaccine that is given, and then some people are given something else and nobody knows which ones until the end. So the placebo or the vaccine people are watched carefully for 2 months. And then they look to see, one, did the vaccine work? And two, were there significant side effects? And health professionals know that for vaccine testing, you are going to see side effects within the first 2 months. That's been the standard. There were almost no side effects, very, very minimal. The typical ones are the things you would have with a flu shot. You've got a sore spot where you had the shot. You might feel kind of under the weather, maybe a little bit tired, a little bit achy for a day or two. And that's what people felt, not all, but some felt when they had the COVID-19 vaccine. So the results were scrutinized, as I said, by the FDA first, and then by the panel of medical experts. And all of those people are not affiliated with President Trump or any other politician, nor are they affiliated with the companies who are making the vaccine. So we can trust the scientists, the medical professionals. This is a safe virus. Really, the side effects from the vaccine are much less of a worry for me and for other health professionals than the possible illness and symptoms from getting COVID-19. So I really, really encourage everybody to be eager for their time, be patient until it's your time, and then get shot 1 and shot 2 if it's either the Pfizer or Moderna. So we'll have to wait and see on the other vaccines. And right now, none of them are ready. They're still being tested. And we'll just have to wait and see if there's going to be other vaccines available. Probably the earliest I've seen is the end of February, but that's just a possibility. That's not something we know for sure. So how do you keep safe now? How do you keep safe until most people have had a vaccine? Is all the same. Keep on wearing a mask. Keep on keeping 6 feet apart from other people. Avoid large group gatherings. That's a big one that's difficult this time of year. But if you have one lonely Christmas, isn't it worth it to stay well and to then get your vaccine next year? And then we can be hopeful that this will be one and done, no more lonely holidays. So avoid the group gatherings, wash your hands diligently. You come in from being out, especially if you've had to shop or do something else. And then be patient and then be willing to get the vaccine.
Excellent. There are a couple questions.
Sure.
So you talked a little bit about what's in the vaccine, and somebody asked, what are the other parts? I assume they mean what else is mixed in the
Sure.
vaccine?
So within it, it's called buffer salts, things like a little bit of potassium and some other things, and lipids, which are fats. So there's 4 different fatty molecules that kind of go around it to be a protective capsule. And then a tiny, tiny bit of sugar that keeps the lipids from being too sticky. So those are all typical things that go into vaccines. And not any of them are something that's going to be a worry for you. I will say, because some people may have seen this in the news, as with any vaccine, some people had an allergic response. And that kind of made the news in England because I think 2 people out of thousands had a significant response and needed to use their EpiPen. And when I looked into it more, those people had significant allergies to multiple medications and multiple foods. So much so that they're always carrying an EpiPen and they're always prepared to use it. So I think for most people, it's not like for me, I have a dust allergy. Well, that's no big deal. That's not going to affect anything when I'm going to have the vaccine. But for most of the time, for even when I had my flu shot, and I had that in a lineup of vehicles, it was wonderful. But they said, go park over there after you've had the shot and make sure you don't feel any immune response. So, you're having a problem because then they want to know about it. So most people are not going to have a problem, and we can feel safe when we have it.
Just a couple more questions. So how does your body build the immunity if you're not actually getting the virus?
So this happens and has happened over the years. There's really all the vaccines now are not live. So it's a part of a dead virus or a dead bacteria, whatever, for any vaccine that goes into the body. But the body recognizes it as danger, 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 and develops a response, an immune response with the blood cells that are warrior cells, the white blood cells. So they are prepared for if the real thing, the whole virus, should enter the body.
There is a question about vaccine manufacturers not necessarily being free of any liability. I'm not sure we really have information about that, but there are systems to report, right? If there is a
Oh,
negative.
yeah. They want reports. Yes, there
Mhm.
definitely are. And I looked up, and I don't want to go into detail or take too long, but I looked up the information sheet, both for health professionals giving the COVID vaccine and for people who get the vaccine. And there's a lot of information there about reporting any side effects, any allergic response, because the government wants to know. And then, of course, actually, if you think about it, the company that's making it wants to know too, because it could vastly affect what they're doing. So yes, there's a lot of mechanisms in place for reporting.
And do you think that it's as safe as a flu shot? That's another question.
I do, yes.
I know too, Ashley's going to talk a little bit about people with sensory difficulties getting a shot. And just wonder if you have any thoughts or recommendations for medical professionals, because this is a situation where a lot of people are going to get this shot and maybe haven't come across someone with a disability. So just wonder what your thoughts are about that, because I know Ashley and I talked about that a little bit ahead of time.
So there's a couple of things about the situation for people who are scared of shots or have a very difficult time holding still for a shot. I've spent years working with individuals with developmental disabilities in the community. And so this is with that hat, I'm speaking that you need to prepare as individually as the individual, if it's going to be in a doctor's office, letting the office know in advance. If the person does well with explaining ahead of time what's going to happen, or whatever the very best caregiver that the person trusts to go with them. Those are all kinds of things you can do. There are plans in the making, not in place, for the pharmacy clinics, or for going into a pharmacy to have an injection. So if somebody has this huge fear of a doctor's office, it might work out to go to a pharmacy. I have a friend who's a pharmacy tech, and she's getting training already to prepare to give injections when we get to that point, as Mitch was talking, it's going to take time, where she will be able to give injections. Also, there is in the planning sites where people can drive up, and you can have the injection while you're in the car. And that may be the best option for some people. It may be if somebody has a severe, severe fear of needles, that you want to keep informed about any vaccine that requires only one injection, because that might be a better choice for somebody who has that kind of challenge. So it's not simple, it's individual, but it's worth figuring it out and doing what works best for somebody.
Excellent. Those are all great suggestions. We really appreciate you helping us out and giving us all that great information. There was somebody on Facebook who said, ask your doctor if you're unsure. I mean, that's definitely, a good, go to your doctor if you have questions or you're unsure. They're probably the best person to answer that. And I'm sure they're getting a lot of questions and preparing to, answer those questions for whoever's interested. All right. I'm going to turn it over to Shannon. She's going to help share our new plain language COVID-19 vaccine sheet. I already thought about another addition to it, thinking about recording if you have any issues with the vaccine. So, slowly but surely, we will have everything we need on this sheet. So take it away,
Right.
Shannon.
I'm sure it'll be a living document, since this is a continually unfolding situation. So, we had intended for this document to go out soon, so we may just do that and then continue to add, just so people can start getting the information. So the Living Well team, we worked to create this based on, the input of experts and what we also saw through other resources. It's a plain language document that you can distribute to self-advocates and families, answering some of the key questions. And I won't go through the actual responses to these questions, just because I think Marcia and Mitch answered most of them. So going through what is the COVID vaccine, is the shot safe, why get the shot, who should get the shot, where to get information about the COVID-19 shot, and the plan for distribution. How does it feel to get the shot, what to expect, because there may be some, symptoms after, and then, when to get it. And again, there's the plan. So determining who's, first in line for that. If you've already had COVID, whether or not you should get the shot. And that's, again, something that you should ask your doctor about. There's still decisions being made about whether or not someone's had COVID and whether it's been recent, where they fall in line. As Marcia said, as we wait for the shot, or even after getting the shot, it's still really important to maintain all the safety protocols that we've had in place: mask wearing, social distancing, washing hands, avoiding large crowds and whatnot. And then just a reassurance that the COVID-19 shot, and we have COVID-10 shot here. I just noticed the typo, Sally, so we'll have to fix that before it goes out. Anyway, a COVID-19 shot, it's free of charge to people. So, your insurance may be charged, but you shouldn't incur an expense to get the shot. Okay. So that's the document here. And like I said, we'll add some more information, fix our typos, and be sending that out through BPDD's Power Mail system, and posting it on the website. So if you haven't yet joined the Board for People with Developmental Disabilities email list, their Power Mail list, you should hop on their website and sign up through their website portal to get documents like this, as well as lots of other resources.
I did post the link to the document, which it will still be the same link. We'll just correct that COVID-10. I'm just laughing because, only 6 of us read the
It
document.
isn't until we show it live that we see some typos. That's the way it goes.
There were a couple other questions after Shannon got started. So whoever, these might be probably for Marcia, or really anyone. So the one person said they work with a lot of people with disabilities who may be getting information from the wrong sources, and that they are saying already that they're not going to get the shot. And just talking about ways that we can really help people understand the importance of getting the shot. And then the second question was, do we have any estimates when 80% of the population will have the shot and we can start gathering?
Okay, I'll take a stab at it. This unfortunate ability to access lots of wrong information is there. I mean, it's as close as your phone. It's as close as all the different media that we can access. I really, in this situation where the person is very reluctant because of what they're reading or hearing or seeing, I would encourage finding a trusted health professional. So if the person trusts their doctor, here we go again, but or if they have a WIN nurse, got to put a plug in for where I used to work. If they have a health professional that they know and trust, that has the straight information, I would encourage asking that person to talk with the individual who's reluctant. I also think over time, unfortunately, among the general population of the United States, looking at polls that have been taken, there is a lot of reluctance among the general population to having the shot. And I'm really hoping that as time goes on and as they see people having it, that they will have less reluctance and will have more trust in the system and in getting the vaccine. So part of it may be finding a trusted professional, part of it may be time. And what was the second question about again?
It was about when do we think we'll reach 80%, which is that kind of magic number that's been out there about when that, most of people will have it and we can start gathering like normal.
So I'll take a stab at it. Mitch may want to address it as well. What I've said, I did presentation yesterday, that question was right up front, is it depends on you. It depends on the people you know. It depends on the general public's willingness to have the immunizations. So we can't know yet how fast the vaccine is going to be disseminated and if there are going to be additional vaccines that will be available. That's one factor we just have to wait on. But the other piece is people's willingness to have the vaccine. And each of you can really be a positive influence, first in getting it when you can, and then encouraging everybody else. And so if there's an agency, for instance, that's working with individuals in their homes, that agency can be a strong proponent. The other piece is, making it convenient. So we've talked a lot about how will people get their vaccine. I would strongly encourage that if there's an agency that provides support, like for people in Iris or wherever, that they set up something with Walgreens, for instance, that people who are their staff can get the vaccinations right at their office. The more convenient we can make it, once there's enough vaccine, the better it will be too, as far as getting people willing to get it done. It eliminates some of the excuses. Mitch.
Yeah, I think you're totally right, Marcia. It's up to people to take it. I mean, we could have we could have truckloads of this stuff laying around. If nobody takes it, it doesn't matter, right? So, and all this, really bad and misleading information about vaccines. It's not just this one. There's a lot of it out there about all sorts of vaccines. And it's just mostly not at all true. So I think we'll probably, from what I can tell from the information I've gotten and the committee I'm on, we kind of expect that there will be enough actual vaccine out there for most people who, probably by the beginning of the summer. That's kind of what we've been looking at. By the beginning of the summer, pretty much anybody who wants to take the vaccine is going to be able to get it from some place. So, if we have, a good response in terms of people, just use their common sense and take the stupid thing, hopefully by the beginning of the summer, we'll have acquired what they call this herd immunity thing, where enough people are protected against the virus so that it has trouble, going between people, because it gets to one place and it can't stay alive because this immune system is killing it off. And, the more people who are killing it as it gets to them, the fewer chances it has to get to the next person. That's kind of, at least the way I look at it. I don't know if that's right or not, Marcia, but so hopefully, by the beginning of summer, when it's nice, enough of us will have taken it, and you can really start, behaving like regular old normal people and hugging each other again. So, let's all be part of the solution and not part of the problem. We're smart people. Take the stupid vaccine when you can. That's what I'll say.
I think too, we look at the resources from the CDC and also the Wisconsin Department of Health Services. Those are good places to look. I think the other thing too is that, the information about the vaccine and who's taking it, it's going to keep compiling. There's going to be data that shows that it's safe as we go on. So it might not be your turn, and even by the time we get to your turn, there'll be lots of good information out there about how the vaccine is safe. So the more people who are getting it right now is just more good data for you when it comes your turn. All right, so I'm going to turn it over to Ashley. She's going to talk a little bit about her thoughts on the vaccine and about people getting it. You're there, Ashley?
Yes, I'm here. I think it's really important for people with disabilities to get the vaccine right away, because we all want to get back to a normal life and go to the movies, go with our friends to places and hug each other and see each other. So I know that there's going to be sensitivities, and obviously, we should train healthcare professionals how to work with people with disabilities. But I think that we need to get back to normal, and I really think that eventually it'll help the whole mental health crisis, being and seeing people and hugging each other, and it'll just be a whole more positive outlook in life. And also, I'm concerned about my friends in group homes, that they're isolated and locked in group homes, that they're not getting out and about and stuff like that. I personally have sent them packages, and I continue to communicate with them, but I think that they need that vaccine right away. So that would be my concern.
So you're going to encourage your family and friends, right, to get the vaccine when it's their turn, right?
Yes, and I will be first in line to get the vaccine too, because I want to go to the movies with my friends and I want my friends to get it right away, because some of them have more barriers than others and they need to get it right away. So I encourage anybody who can get it right away to get it, so we can get back to normalcy and see each other and hug each other, because we just the effects of seeing people is so positive, and I think we've learned the value of people and seeing each other because of this virus. So I think that now we're going to start maybe appreciating the hugs, the smiles, and the hard work that people do, because because before this virus, I don't think that people knew the value of people, but I think now they do.
Absolutely. That's a great message. Nathaniel, how about you? What are your feelings about the vaccine?
My feelings of the vaccine is that once it's a go, everyone should get it, depending on if you can get it or not, depending on what your doctor says, because you never know on each case. And please talk to your doctor if you have any, or physician if you have any questions, for the most, because you never know on each case. For me personally, I think that I'm eager to get back to being like a mentor, being um, able to advocate for people who have been isolated, and be able to reach out and being assistance to people who want to have a voice, and being able, go places, and like what Ashley said, see friends, and reconnect with old friends, and reconnect with family. I haven't been able to see my brother for probably, maybe a year, and I think that's very, very sad in a way. But I think that if everyone does their part, we'll be able to see our loved ones sooner than later. So it's very important for everyone to get the vaccine.
I think too, one thing we had maybe talked about too was people who want to work, that there are people who are not able to go out and work because of the issues with the virus. So that's another important piece too. I think Ashley had said something about that. But
Yeah, and that's why I said, like, going out being a mentor, going out being an advocate. Like, I want to start a People First of Wisconsin group for Baraboo, Wisconsin Dells, and Sauk City. And I won't be able to get like a formal meeting going until everything opens up. So there's a lot of planning that I want to get done. And I think that if everyone goes out and gets the vaccine, everything can get back to normal sooner than later. But each of us has to do their job to go out and get the vaccine.
absolutely, that is the best of the best. So I'm gonna just close it up here. Thank you all so much for joining us today. It was a great conversation. We will have this up on our Facebook page. We'll post it to our YouTube channel in a day or two. And just one of the last comments from one of our participants on the Zoom, which I think is very appropriate. We're never going back, we are going forward. So that's what we have to think about. Everybody going forward and doing their job and getting the vaccine. So thank you so much for joining us. We appreciate it, and we will see you next time.